Bacillary angiomatosis. The skin lesion in bacillary angiomatosis are solitary or multiple, red, flesh-colored, or colorless papules and nodules that bleed easily. Summary: Bacillary angiomatosis is a skin condition in immunocompromised patients, especially patients with AIDS and CD4 count less than 100, characterized by vascular proliferation that results in lesions on the skin and potentially other organs, for example GI tract, respiratory tract. It is caused primarily by Bartonella henselae, which is most commonly transmitted via cat scratches. Skin manifestations include red papules and nodules that bleed easily. Diagnosis is confirmed on biopsy. Antibiotics are used to treat bacillary angiomatosis, and patients with HIV should be started on antiretroviral therapy. Etiology: Primarily Bartonella henselae, which is most commonly transmitted via cat scratches. Less commonly, Bartonella quintana, which is mainly transmitted by body lice. Body lice are most commonly seen in patients living in crowded conditions with poor access to sanitation, for example in homeless shelters. Clinical features: Seen primarily in immunocompromised patients, especially patients with AIDS and a CD4 count less than 100. Solitary or multiple, red, flesh-colored or colorless papules and nodules that bleed easily are the skin lesions in bacillary angiomatosis. Fever, chills, malaise, anorexia can also occur. Bacillary angiomatosis. Two angioma-like lesions with a surrounding erythematous halo are visible. This immunocompromised patient was diagnosed with bacillary angiomatosis due to Bartonella quintana. This is a rare infective condition with red vascular lesions erupting in a patient with AIDS. Bacillary angiomatosis. Diagnostics: Biopsy of lesion is the first-line test for diagnosis. Benign capillary vascular proliferation, neutrophilic infiltrate. The Wurthin steri stain is used to visualize bacilli. These are the findings of biopsy. The following studies may provide supportive evidence but are not widely available or used. Serology may be negative in up to 25% of patients with HIV because HIV patients do not produce sufficient antibodies. Blood or tissue culture for isolation Bartonella may be negative even in affected patients. PCR of tissue samples. Serology may be unreliable in advanced HIV infection as some patients never develop antibodies. Neutrophilic inflammation is seen in bacillary angiomatosis on biopsy. Lymphocytic inflammation is seen in Kaposi sarcoma on biopsy. Treatment: Initiate antiretroviral therapy if not already started in patients with HIV. Antibiotic therapy. Preferred agents: erythromycin and doxycycline. Erythromycin 500 mg per oral IV every 6 hours. Doxycycline 100 mg per oral IV every 12 hours. Duration of therapy at least 3 months. In seropositive patients, serial IgG antibody titers every 6 to 8 weeks can be used to monitor response to therapy. A four-fold decrease in titers indicates treatment success. Management of recurrences. Recurrences are common. Switch to antibiotics from a different drug class for at least 3 months. Consider rifamycin for severe disease that is switched to doxycycline if the patient received erythromycin and vice versa. Prevention: Bartonella henselae limit cat ownership to cats greater than 1 year old and in good condition, provide regular flea treatment, reduce the risk of cat scratches, avoid petting stray cats and playing roughly with cats, clean and scratches promptly with soap and clean water. Bartonella quintana advise patients to avoid sharing clothes or bedding, wash clothes and bedding in hot water, greater than 50 centigrade or 120 Fahrenheit, provide treatment to patients affected by body lice. Thank you.